Hello, my name is Denise, and I live in the outskirts of São Paulo City in Brazil. I am a childbirth activist, and I am here to talk about the project Perinatal Data Health Literacy for Community Engagement that I developed with a group of researchers and social movements representatives. We developed a data literacy program for doulas and childbirth activists, focusing in the development of skills to access, read, understand, analyze, and publish data from our health information systems. But first, I would like to say why I have decided to do such initiative. Because in 2005, after giving birth to my son, Murilo, I became an activist because I wanted to share my experience with other women, and I wanted to tell them how wonderful it was to make informed decisions. So I joined a group of women and we started researching evidence and data regarding the childbirth care context in Brazil. This resulted in a dossier and afterwards in a public civil action that transformed the obstetric care context in Brazil as it allowed us, health system users, to know the C-section rates by physicians and by maternity service. The physicians, health plans, and health insurance could no longer deny that we had a problem with abuse of C-sections in the private sector. So I had the opportunity to go to university and study, but then again, I had to learn a lot of concepts and skills to help write the dossier. It was not easy. And that's why I had my master's in science, because I wanted to know more about evidence and data so that I could be a more effective activist. This took me to the public health field, where I got my PhD and where I developed my postdoctoral research. And one of the components of this research was the data literacy program for doulas and childbirth activists. I wanted to do that because comparing to when my son was born 18 years ago, now we have a lot more information available. And now I have knowledge and skills to access and analyze such data. So I want to teach as many women as possible how to do that. It is not so hard. It just requires a computer with access to the internet and a web browser. This is all we need to know, for example, the number of C-sections performed in a maternity service, or how many teenagers gave birth during the pandemic, or the proportion of Black women who suffered an induction, or the proportion of preterm births in a city, and so on. The data is there, just waiting for us to use them. And when we are able to do that, we can demand action from health managers and policymakers. I firmly believe that this is an effort to make childbirth care more equitable in Brazil and an important action to promote democracy. Thank you very much.